Hi, I'm going to be giving you a report on Miss Ella. So Miss Ella is a 23-year-old adult female with no history of respiratory illness. She's presenting with an intermittent non-productive cough that began 3 weeks ago at a dance class, but now has worsened into a painful productive cough in the past 4 days. For a history of her presenting illness, she describes the location as an itch in the back of her throat and her neck, as well as chest pain with coughing. She reports that the cough was intermittent and dry when it started, but now it is a constant and it's producing green sputum. The chest pain is described as a sharp, stabbing pain when she's coughing, but denies any pain at rest. She reports that it gets worse when she exercises, but also describes no alleviating factors. Prior to this, the cough was intermittent, coming and going, until 4 days ago, and now it's become a constant coughing episodes throughout the day. The severity of her pain is rated at a 6 out of 10, and it also prevents her from performing her usual activities, which includes dancing and school. So the associated symptoms would be the chest pain, shortness of breath, and dyspnea after the coughing episodes, nasal congestion along with a runny nose, as well as a low-grade fever of 37.6 Celsius last night. Some of the treatments that she's tried were cough candy, dextromethorphan, and Tylenol for the fever, but the cough candy was ineffective, and she says the dextromethorphan was only effective for short periods of time. The pertinent positives include nasal congestion, runny nose and fever, tender cervical lymph nodes, dyspnea and shortness of breath worsened by exercise, as well as a personal and family history of allergies, which causes eczema. The pertinent negatives include no recent weight loss or weight gain, no GERDs or ascites, no malaise, no edema or cardiac history, no recent aspiration or recent travels anywhere, and she says she's not living in a poor socioeconomic area, and she does not smoke cigarettes. She has not had this evaluated prior to coming into the clinic today, but she says she has generally a pretty clear bill of health. She describes her allergies as exacerbated by animals, and it causes eczema, which can get quite bad. When it gets bad, she uses hydrocortisone cream. She denies any drug allergies. Aside from the treatments that I mentioned earlier, she uses moisturizing creams and hydrocortisone for her eczema, and she denies taking anything regularly. For her past medical history, it was largely unremarkable, aside from the allergies and eczema. She denies any previous hospitalizations or surgeries. She's currently a third-year university student living in a dormitory with shared space with 3 other women. She says she's also a competitive dancer in gymnastics, so she trains daily, but has been unable to do so because of the cough. She denies any tobacco use, but says she occasionally drinks alcohol and smokes marijuana, and also ingests it. Upon her physical examination, the vital signs were mostly unremarkable. SpO2 was 95%, her temp was 37.2. On the relevant systems, we looked at head, eyes, ears, nose, throat. Her head and eyes and ears were all unremarkable. Her nose, she reported mild pain and discomfort when we palpated her sinuses. Her nares are congested and is runny with a clear exudate. And the nasal mucosa is red and inflamed, also covered with the clear exudate. Her mouth and pharynx showed that the pharyngeal and uvular erythema, along with tonsillar exudate. The tonsils in the back were equal and symmetrical without enlargement. There's no ulcers or masses noted, and her tongue was largely unremarkable. And for her neck, the only thing that stood out was the enlarged and tender cervical nodes. I also did a chest examination, which also came up largely unremarkable. Breath sounds were clear. Heart sounds were also unremarkable. Her skin and extremities and abdomen were all unremarkable. So in summary, Miss Ella is a 23-year-old female with an intermittent, dry, non-productive cough for the past 3 weeks, which has worsened into a painful productive cough in the past 4 days, along with a low-grade fever. The intermittent coughing episodes are exacerbated by exercise and is occasionally associated with dyspnea, shortness of breath, and centralized chest pain. She has a personal and family history of allergies and atopic dermatitis and occasionally uses cream for treatment. Her current presentation with the red and inflamed nasal mucosa, pharyngeal erythema, and enlarged cervical lymph nodes suggests nasopharyngitis, the common cold. However, the coughing episodes and dyspnea from certain triggers, such as exercise or exposure to allergens, are suggestive of asthma. Some differential diagnoses we consider are acute bronchitis and atypical pneumonia. Thanks.